topics, which is pressure, flow and resistance. So whenever you take care of the blood during bypass, it is mandatory to view the hemodynamic status of a blood flow. So in which the pressure is a major thing. So maintaining pressure on bypass is a crucial and important thing to be done on the surgeries. So in which we are seeing systolic, diastolic, pulse pressure, mean arterial pressure, line pressure and the arterial side. So maintaining the blood pressure of a BP and regulatory mechanism of the BP is very much important. Why? Because that will give the tissue perfusion and increases the oxygen delivery to the tissues. So whenever we are doing a perfusion, it is mandatory to maintain a mean arterial pressure of 60 to 90 mmHg. To attain the pressure of 60 to 90 mmHg, it is important to maintain a systolic of 120 and diastolic of 80 mmHg on bypass. It is not exactly what we are discussing here. It can either be up and down because of certain factors. These are the certain factors which can influence the blood pressure. The venous anesthesia, that is administering the anesthetic drugs, can cause vasodilation and relaxation effect, so that your BP gets dropped on that phase. And one is flow rate. As a perfusionist, we are giving a flow rate based upon the cardiac index. So BSA into cardiac index is a formula for flow rate, in which the cardiac index we are calculating is of 2.4 liter per minute per meter square. In that, the flow rate will be altered according to the temperature and according to the needs of a patient. So, as of calculated flow rate, we can reduce the flow rate when the temperature is reduced. But keep in mind that if the flow rate is reduced, automatically there is a decrease in the pressure as well as decrease in the resistance to the flow. Next one is obstruction. Obstruction can occur anywhere in the tubes or anywhere in the patient. So this obstruction is nothing but the resistance what I have mentioned here. So maintaining a systemic vascular resistance of 700 to 1200 lines per minute per meter square is very much important to give the proper blood flow to the patient. So what happens to the BP while the flow rate is when the BP is reduced, automatically the flow rate is get altered. So as an example, when you give a flow rate of decreased 3 liters for the patient who needs a 4 liters, automatically their BP gets dropped and their flow to the vital organs can also get dropped. Why? Because the autoregulatory mechanism which is happening in our body is not functioning during the surgeries. The autoregulatory mechanism is totally carried over by the heart language. Next one is arterial line pressure. So it is a pressure which is exerted on the arterial cannula, arterial side and arterial line of the patient. This pressure is almost as of theoretically it is 100 to plus or minus 10 mmHg, but it is okay to go with 150 mmHg till bypass. But if it is more than 150 mmHg, there is a high chance of line rupture or an aortic dissection that can happen on the patient side. So it is mandatory to maintain an arterial line pressure at an appropriate rate. And also, the another thing is central venous pressure. Central venous pressure is nothing but the pressure on the right side of the heart where you get some proper drainage. So the pressure on the right side of the heart should be approximately 0 to 12 mmHg, but on bypass we need 0. Why? Because 0 on bypass will indicate a good venous drainage. That means what? The heart is totally empty and you are draining all the blood from the patient. So that is very much important to maintain a CPB of 0. That means a proper cannulation, proper selection of cannulation and proper position of the venous cannula below the patient bed level is which important to attain a gravity. Gravity symphonage will give a good venous drainage. Next one is the fluids. Increase in hemodilution is also a major factor. So maintaining a fluids is based upon the primary volume calculation. As an adult will calculate patient weight into 20 ml and for the pediatric patient weight into 30 ml. If you are calculating on that way, you can give appropriate amount of needed priming solutions. But if you give more amount of priming solution to the patient, that can cause hemodilution. So hemo means blood, dilution means the blood cells gets reduced in its levels. Mainly the protein. The protein present on the blood cells, albumin, globulin and fibrinogen, their count is totally reduced. When that is reduced, it will cause a decrease in colloid osmotic pressure. When decrease in colloid osmotic pressure occurs, automatically the fluids will start shifting. And also the anticoagulant effect. So when you give a heparin, that increases your decreases viscosity rate, that is your decreases your thickness of the blood, automatically it increases your microvascular circulation. And these are the calculations of heparin that we are giving on the circuit. It is 1 mg per kg for the circuit and 3 mg per kg for the systemic circulation. So overall, maintain all this during bypass to maintain an hemodynamic blood flow in a proper way. Thank you.